Hi, and welcome to the Neuroscience Times. I'm your roving reporter, Carla Shepard, here to discuss our main article today, Bell's palsy. What is it? Bell's palsy is an idiopathic facial paralysis that usually occurs suddenly. It involves damage to the facial nerve. Weakness presents on one side of the face. It may affect tear and saliva production and difficulties with hearing, vision, taste and smell, and facial numbness occurs. What it is not? Bell's palsy is not a stroke or a trans-ischemic attack, and there is no relation between the two. This denotes the importance of contacting your physician and having a more serious condition ruled out. Bell's palsy is not contagious. Well, how do I get it? The cause of Bell's palsy is unknown, although it is evident that there is damage to the seventh cranial nerve. The nerve becomes swollen, inflamed, or compressed. Can't use that. That's going to show up on the screen. Hi, and welcome to the Neuroscience Times. I'm your roving reporter, Carla Shepard, here to discuss our main article today, Bell's palsy. What is it? Bell's palsy is an idiopathic facial paralysis. The onset is sudden and involves damage to the facial nerve. Weakness presents on one side of the face and may affect tear and saliva production. Difficulties with hearing, vision, taste and smell, and facial numbness are evident. What it is not? Bell's palsy is not a stroke or a trans-ischemic attack, and there is no relation between the two and Bell's palsy. This is why it's important to see your physician to rule out a more serious condition. Bell's palsy is not contagious. How do I get it? The cause of Bell's palsy is unknown, although it is evident that there is damage to the seventh cranial nerve. The nerve becomes swollen, inflamed, or compressed, usually because of a viral infection, such as meningitis or the common cold. Exposure of the face to a cold draft may also be a cause. There also have been links to stress and Bell's palsy. Associated conditions include influenza, pregnancy, tumors, diabetes, headaches, Lyme's disease, chronic middle ear infections, high blood pressure, sarcoidosis, and head trauma. 1 in 40,000 Americans contract Bell's palsy. Men and women are affected equally, and less common before the age of 15 than after the age of 60. How severe is my case? The classifications of Bell's palsy are related to the recurrence. There is unilateral non-recurrent, unilateral recurrent, simultaneous bilateral, alternating bilateral, and recurrent bilateral. Facial paralysis is graded by the House-Brackman classification system, which you see here in the table. The grades are related to the amount of facial paralysis that the physician notes. Is there a cure? There is no known cure for Bell's palsy. Although the prognosis is good, it depends upon the onset. Generally, the symptoms reside within 6 months, and recovery is gradual and varies. People usually report feeling better with or without treatment. Most have complete recovery. Some symptoms last longer. Few people symptoms don't disappear, and in rare cases, symptoms reoccur. Approximately 15% have residual disability. This is a video of one man's journey through Bell's palsy.
Divided by you, divided in two. Don't stray too far that you may never return.
Hi, I'm Grant. Today is December 26, 2013, and it just so happens that today is my 37th birthday. 4 days ago, I was diagnosed with Bell's palsy on the right side of my face. I thought I would try to do something positive with the experience by making a video diary documenting my recovery so that anyone else could get an idea of what they might expect to see in their own improvement as time goes by. So this is the first day of my video diary. Was diagnosed 4 days ago. Came down very suddenly. I just happened to be out with friends and I noticed that my lip was numb, and then gradually over the course of the day my eye began to water more, had difficulty controlling my eye, also got a headache and some shoulder pain, and by the next day my right side of my face was pretty much totally frozen. Since that time, it's actually gotten worse. So I'm now on day 4, and this is probably the worst day it's been so far in terms of paralysis. My taste sensation for foods has changed dramatically. I do still have hearing in my right ear, but otherwise I have virtually no control over my facial muscles on the right side of my face. Talking is difficult, eating is difficult. Pretty much everything is a lot more difficult now, and I tape my eyes shut to sleep at night. I have gone for Chinese acupuncture, and I'm on Chinese herbs as well as steroids prescribed by the doctor, and vitamin B complex, vitamin E, vitamin D3. I have already been on a vegetarian diet for 6 years, so I'm pretty healthy. I'm just doing what I can to keep my health up. You can either get out or stay at home, but either way your face is going to stay the same, so why not get out and see the great outdoors and do something? So it's now day 11 of my struggle with Bell's palsy, and I came out for New Year's to Wilson's Promontory National Park in the state of Victoria in Australia. Went on a 4-day trek, 3 nights, 4 days, and in the past 11 days my Bell's palsy has actually gotten worse, I think. I've gotten acupuncture twice, I've been on Chinese herbs, I've gotten massage from friends and a professional as well as acupressure, but my face feels more paralyzed now than it did at the start of this ordeal. But the reason that I decided to record this video out here is to inspire people to go out and have your own adventures, and don't let a condition like this keep you indoors, because there's a lot of beauty out there, and some of your healing can come from being out in nature and facing people and having conversations and doing whatever you can to stay active and stay motivated.
Divided by you, divided in two. Don't stray too far that you may never return. Please, please, don't stray too far that you may never return. Please, please, you're my brother. Divided by you, divided into time to disconnect myself from you because I love you. I love you. It's time to disconnect myself from you because I love you. I love you. And you don't know how hard it's hit you. And you don't know how hard it is to see you falling. And you don't know how hard it's hit you. And you don't know how hard it is to see you falling. Falling.
I hope you enjoyed the video. It leads right into the next discussion. So what do I do now? Well, as you saw in the video, there are many treatment possibilities for Bell's palsy. Anti-inflammatory drugs and steroids were mentioned, antiviral medication. He also talked about eye ointments and patching, and on the web I found physical therapy listed, but we all know that occupational therapy can be important as well. The alternative or homeopathic treatments can include herbal and viral vitamin supplements, relaxation techniques, acupuncture, e-stim, massage, and facial exercises. The occupations that are affected from Bell's palsy include managing medication, eating and feeding, grooming. Communication management could be affected if it's very hard to understand what they're saying, and stress management. Interventions include oral motor exercises, offering adaptive equipment, coping strategies, modalities such as e-stim, massage, and assistive technology may be necessary in the severe cases. Bell's palsy is the most common facial nerve disease. Here are my references. The video wouldn't post in the reference because it popped up on the screen, so that's why that's lacking at the bottom. And here is my link in the Google Docs for my worksheet. Hope you guys enjoyed the presentation. I know I had a great time preparing it, and I hope you have a wonderful day.